Medical professional liability claims are contributing significantly to the increasing health costs by increasing the premium associated with malpractice insurance. It also increases the cost because the physicians are practicing defensive medicine. Gastroenterology stands out as one of the top 10 medical specialties prone to litigation. The trends in gastroenterology, diagnosis, and endoscopy related medical professional liability claims need to be studied to educate the gastroenterologist towards risk management. This helps to identify the variables associated with increasing MPL claims and help contain the costs by proper training. So, MPL Association has collected data and analyzed the data from 2006 to 2015. 90,743 MPL claims were closed. 1,800 of them were against gastroenterologists, which amounted to 2.07%, sorry. 24,000 were paid claims. 367 of them were against gastroenterologists, amounting to 1.5% of the total claims. 71% of the claims were dropped, withdrawn, or dismissed. MPL claims involving the procedures of large intestine were the most common, accounting for 26% of all closed claims, resulting in a payment of around $18,400,000. Average indemnity was highest for ERCP, amounting to $485,000, followed by small intestine, which accounted for $336,000, followed by colon procedures, which amounted to around $302,000. The least was for procedures involving esophagus, which was around $267,000. The average indemnity rose by 8.2%, while the legal costs rose by 8.7%. Adequate endoscopic training, meticulous focus on procedural indication, clear and detailed documentation from the physician standpoint, and liability reforms from the government standpoint might help cut down these rising trends. The variables such as procedural volumes during training, improved documentation on electronic health records, adenoma detection rate while training and while you are in practice, and the proposed medical liability reform mechanisms might be the variables that are needed to be studied. I would like the listeners to refer to a recent article in Clinical Gastroenterology and Hepatology by Drs. Megan Adams and John Allen, which discusses in detail about this. The traditional and alternative mechanisms of liability reforms are discussed in detail in their article. The traditional mechanisms include damage caps, limits on attorney charges, pre-trial screening panels, periodic payment, etc. Alternative mechanisms include safe harbor rule, health codes, disclosure or offer programs, no fault compensation systems. Some of these mechanisms have been studied with funding from the government, and the Agency for Health Research and Quality has published the outcomes of these studies. We need a large database generated from data collected from all insurers for future to study these variables in detail.